Welcome. I'm Dr. Megan Davis. I'm the chair of the Master of Public Health program at Johns Hopkins Bloomberg School of Public Health, and I'm trained as a veterinarian with a long background in antimicrobial resistance from the field to the bench to policy. And I'm here to welcome you to the Trinity Challenge on Antimicrobial Resistance. It's a global prize competition funding teams using community data to combat antimicrobial resistance in low and middle income countries. It received 285 applications from 57 countries and awarded 4 prizes in 2024. I'm on the Strategic Advisory Board and have met with the teams, and I'm delighted to introduce them here and help moderate to showcase their progress. We'll begin by hearing from Professor Helen Nguyen from University of Illinois, representing the Farm to Vet team in Vietnam, the grand prize winner of the 2024 Trinity Challenge on Antimicrobial Resistance. Dr. Nguyen.
Hello, my name is Helen Nguyen, and I'm professor of environmental engineering at University of Illinois. For the Farm to Vet project, I'm a lead of this team, and our project is based in my birth country of Vietnam.
Great, thank you so much. Now we're going to hear from Dr. Priya Balasubramaniam, who is from the Public Health Foundation in India, representing the OASIS team.
Everyone, I'm Priya Balasubramaniam. I'm a health system scientist with a long history of working in health capacity building and currently work at the integration of low-cost, frugal technologies in building health systems capacity. I'm part of the OASIS project team, which is developing an app which is currently based in the state of West Bengal in India.
Great, thank you so much. Next, we'll hear from Jasmine Kaur from IIIT Delhi, representing the AMR Sense team working in India.
Hello everyone, I'm Jasmine Kaur from representing the team AMR Sense from IIIT Delhi. I'm the lead data scientist in this project. AMR Sense is a consortium of 4 partners, IIIT Delhi, CHRI, Tata 1mg, and ICMR NIRDH, bringing together technology, implementation, digital pharmacy insights, and public health research.
Great, thanks. And finally, Craig Kinnear from SMARC Genomics Platform, who represents the AMR Roots team in South Africa.
Hi, I'm Professor Craig Kinnear, the director of the South African Medical Research Council's Genomics Platform, and also a professor at Stellenbosch University, and I represent the AMR Roots team. That is a team based in South Africa, focusing on antimicrobial resistance in rural farming communities. So our team comprises academics and non-governmental organizations who, together with the community, to better understand AMR in our local farming communities.
Great, thank you so much. So now we're going to go around with each speaker and introduce their work in, we'll just say like 1 or 2 minutes each. And let's start with Farm to Vet.
That have many people from different expertise, from human development to CS and to environmental microbiologists like myself. So we are building a human-driven AI knowledge hub that combines the speed of large language models with scientifically verified, locally relevant intelligence. Our mobile tools, accessible via voice, video, text, allow farmers to record animal health cases in real time. We then use AI to transform these inputs into searchable records, identifying disease patterns before they become outbreaks. This data is then aggregated and turned into micro-learning tools tailored to the farmer needs, while also train a chatbot that offers differential diagnostic suggestions to guide better decision making rather than replacing human vet. We aim to give them a 10x multiplier into the fight against AMR through continuously updated hyperlocal insights.
Oh, it's great to learn more about that. Let's go to Oasis and hear a little bit more about that project.
So India has more than 2 million informal rural healthcare providers in both human and animal health who deliver an estimated 70 to 90% of first contact healthcare. Yet, a lot of these providers operate outside formal health systems with limited clinical guidance and often weak referral pathways. OASIS, also known as the One Health Antimicrobial Stewardship for Informal Health Systems project, is a multidisciplinary project comprising of technology providers, researchers, and behavioral health scientists. This project is building a trustworthy digital support system with and for these frontline health providers and paravets, drawing on nearly 30 years of research into their care practices. At the center of the OASIS solution is the antibiotic Bandhu, a companion application that serves as a comprehensive job aid for rural informal providers as well as paravets. It provides rapid emergency guidance, evidence based clinical decision support for common infectious diseases, systematic patient recording, follow up, simplified guidance on antibiotics and antimicrobial resistance, and referral links to hospitals, experts, and public health facilities. The Bandhu app is currently being deployed with approximately 250 providers across 2 blocks in West Bengal, Haringata in Nadia district, and Debra in Madnipur district. Through this work, OASIS aims to build a scalable frontline healthcare model that strengthens care quality, referral pathways, and antibiotic stewardship where it is needed the most.
Oh, it's great to hear more about that. And now let's go to AMR Sense, also working in India.
So in India, we've made tremendous progress in hospital-based AMR surveillance. We have many national programs also running for that. But many community-led signals remain fragmented or largely invisible. These include how people access antibiotics, many of the self-medication practices, pharmacy-linked consumption pattern, care-seeking behaviors, and the everyday decisions that shape antimicrobial use before a patient even reaches the hospital. AMR Sense was developed to address this missing layer by connecting the community level signals with the policy facing intelligence. It is structured as a community to policy AMR ecosystem across 3 connected pillars: the data, the awareness, and the policy insights. On the data side, we work with the frontline healthcare workers, the ASHA workers, as AMR ambassadors. They are supported through training, awareness tools, AI assisted data capture. The broader goal here is to reduce their burden in data entry while improving the overall structure and quality of data that is collected at the community level. The second layer is the awareness and behavior change layer. AMR Sense uses expert vetted educational content, AI generated videos in both local language as well as in English, quizzes, gamified learning approaches, badges, and CAP assessments to support more responsible antibiotic use among the communities as well as these frontline workers. The third layer is the policy intelligence. These community and health system signals are all combined and translated into dashboards through the AMR Orbit and AMR Aura scorecards, which help identify local level patterns, early warning signals, and areas specific where stewardship action may be needed. So, at its core, AMR Sense is our attempt to build the missing intelligence layer between the community behavior, AMR policy response in converting this ground level evidence into actionable stewardship intelligence.
Oh, that's great. And that focus on the community is so important. So we'll stay with a bit of a community focus as we move to hear more about AMR roots.
So in South Africa, marginalized communities hold 50% of the country's livestock. and about a third of livelihoods depend on 2 million communal farmers. Yet there's very little information about antimicrobial resistance in these settings. So AMR Roots is a proof of concept partnership between academia and non-governmental organizations working directly with a small-scale farming community in South Africa to better understand and respond to AMR. So our research has found that even in remote communities like this one, 76% of rural households use antibiotics in livestock, and antibiotic-resistant mutations in this community were present across many sample types, including human, animal, water, and meat. So critically, we found that farmers lack veterinary support and rely on local vendors who often provide poor quality information and promote unnecessary antimicrobial use. So to address this, AMR Roots is developing a herd health WhatsApp system to connect individual farmers with veterinary advice and expertise. So this is planned for rollout across 180 farmer associations representing approximately 400,000 people in the Eastern Cape and KwaZulu-Natal provinces of South Africa. And so by engaging the community leadership early and involving the youth through filmmaking, AMR Roots ensures that the communities are informed and can represent the interest in the evolving national AMR policy. Thank you.
Oh, wonderful. And just hearing about the innovations has been just a joy that I've had as part of the Strategic Advisory Board. So what I'd like to do is to have teams come on and share a key accomplishment or milestone from the last 18 months. What's working? What impact have you seen? And why don't we just, Dr. Kinnear, since you're here, why don't we start with you and go in reverse order?
Okay, yeah, no problem. So one of our most important milestones, I think, was the establishment of a field laboratory directly within the community where our research was taking place. So we used portable laboratory equipment and sequencing technologies and transformed a small room in a community center into a functioning sequence laboratory. So this enabled us to extract DNA and perform metagenomic sequencing on site from the samples that were collected within the community. So we know that small-scale farming communities across South Africa are often isolated by poor road communications infrastructure. And so having a functional sequence laboratory on site allowed us to monitor circulating pathogens and AMR mutations in near real time. So like I said earlier, we found AMR mutations associated with antibiotics and that were commonly used in the community, meat, water, and human samples. And so given that many households use antibiotics to treat the livestock and often treat them prophylactically, these findings highlight the risk associated with inappropriate antibiotic use. So I think another important finding related to water quality was that approximately 74% of the households rely on river water as their primary source of drinking water. And our data clearly demonstrated high levels of pathogens in river water and other water sources. And through our community engagement activities, we know that access to clean water consistently emerges as one of the community's most pressing concerns. So our work has highlighted some practical opportunities for interventions, and the farmers have expressed strong need for support in managing their livestock health and treating disease appropriately. And so we are developing this herd health WhatsApp platform to connect individual farmers directly with veterinary advice and expertise to support responsible antibiotic use, and also helping veterinary service reach these farming communities who need them most. And we will return next month to present these findings to the community.
Oh, that's great. And congratulations on all your accomplishments. Let's go to Jasmine Kaur.
Yeah. So, over the past 18 months, one of the most important milestones for us has been moving AMR Sense from a proof of concept to an implementation ready AMR intelligence ecosystem. Most importantly, we've moved beyond asking whether the technology works towards bringing together the people, the processes, and the tech stack required to operationalize this community based AMR surveillance at a large scale. This has resulted in a complete operating model that includes frontline workflows, community engagement tools, awareness, training materials, AI assisted data capture, and policy based adaptation. Alongside this, we've also sensitized more than 2,000 stakeholders, including pharmacists, doctors, nurses, lab staff, community health officials, and ASHA workers. For us, this was very important because AMR stewardship will not just be built only through dashboards or tools. It requires awareness, trust, and engagement among people who will actually be using this on the ground. Early insights from the prescription data in collaboration with Data 1mg has revealed several policy relevant signals in access and watch antibiotic use, which have been now shared with the local officials in Bangalore. With the HMSC approvals now in place, we are moving towards on ground implementation across 40 urban primary healthcare centers in Bangalore. So, one of the key accomplishments is that the gap between community data and public health action is now significantly smaller than it was 18 months ago. Our task now is to generate the evidence that is needed to address this gap even further.
Great. And again, congratulations on all you've achieved so far. Let's hear from Dr. Priya Balasubramanian.
Thanks, Megan. I think one of our most important accomplishments has really been using many years of research with informal rural health providers and using this in developing a practical digital solution that's now being deployed in real world settings. So for that, for us, that's a really big achievement and a milestone. So with the past 18 months, we worked very closely with clinical providers, behavioral health experts, veterinarians, as well as health system stakeholders to co-design, create, and test the Antibiotic Bandhu app. So this application is now being introduced to approximately 200 informal healthcare providers, both in human health and animal health across 2 districts in West Bengal. What is working particularly well for us is that the Bandhu responds to providers' everyday realities. And for that, it is really heartening for us to see that it is an application that understands the contextual reality of the grassroots. It's not simply an antibiotic guideline. It offers rapid emergency guidance. It helps with clinical decision support to common infections, patient records and follow up, as well as simple explanations of antibiotics and AMR, and links to formal doctors, hospitals, and as well as referral services in the rural community in which that they are based. So early provider feedback has been really encouraging. Providers value the app because it helps them make more confident treatment and referral decisions, explain their decisions to the patients that they are seeing on a day-to-day basis, as well as it builds and strengthens trust within their own communities. And that is really valuable for us. Our key lesson is that stewardship works better when it actually supports providers rather than simply policing them.
Oh, that's great. And again, congratulations. Let's go to Dr. Helen Nguyen.
So Farm to Vet have established virtuous circles of intelligence, and that is our key achievement. So we can now continuously collect updated field data that reflect the ground reality of AMR, and our models undergo frequent retraining to turn that raw data into timely hyperlocal insights, and then we deliver that verified knowledge back to the underserved farmers. So we are not just collecting data, we are building a self-learning system that make the entire livestock ecosystem smarter and safer every single day. So we work similar to other team. We work very closely with our communities. And at the beginning, like as a technology development people, we try to go and ask people about their pain point and all of that stuff. And what we found out is, no, they actually want to talk about successful practices. When we ask them about what they enjoy in their work, what success they achieve, then they open up a lot more for us. And then we can immediately using AI to create content and turn that into intelligence, and that is the community like that a lot more than textbooks knowledge. So that is the biggest lesson that we learned over the last 18 months.
Yeah, and I think that's such a great theme, right, across all of the projects, those corridors of communication and the different people that you need to engage. And so I'd like to hear a little bit more about what partnerships, funding, or other support you might need to scale the work that you started, and how people who might be joining us today or listening to this later on could get involved or connect. We can go in the original order. So Helen, go ahead.
Oh, yeah, so we have a very strong team in Vietnam. So we have everyone from the government to the community level. So what we really need, of course, beside financial support, to pay everyone, is to have mentoring in cybersecurity. So data security is very, very important, and we also need to. We also want to have more credit for cloud computing, API, AI agent like Codex, and Google services like Notebook LL, and GPU to keep our modern sharp and our data safe.
Oh, that sounds great. And then you're providing that connection to the local farmers who
Yes.
really
Mhm.
want to understand how to maybe better use antibiotics correctly. I know I struggled with that when I was advising my farmers when I was in dairy practice. Go ahead, Priya.
So looking ahead, I mean, our immediate priority is to build strong evidence on whether the Bandhu app is improving treatment decisions, reducing unnecessary use of antibiotics, and ultimately leading to better outcomes. But at the same time, we're also trying to understand what it will take to implement this model both sustainably and at scale. So there are, a couple of practical barriers that we have faced. Funding, of course, is the most obvious. Digital connectivity can also be uneven in rural areas. But more importantly, there is this policy challenge or policy barrier around the acknowledgement of rural healthcare providers and paravets who deliver a very strong and large proportion of frontline care, but they are not always formally recognized.
Mhm.
So, this can often make it harder to establish structured training or supervision or even referral pathways or links to public health services. So, in order to achieve this, we need participants of partnerships at several levels, multi-sectoral partnerships at several levels. And we're really looking to work more closely with state health departments, public and private hospitals, medical colleges, as well as veterinary institutions, particularly to strengthen the clinical mentorship component as well as the referral pathways. We also want to engage provider associations and community organizations who understand the everyday realities of rural healthcare. So, if there are any of you watching today and watching this online, please do reach out. We would welcome your help. Additional funding, of course, is essential for rigorous evaluation and strengthening this particular technology that we're developing, as well as expanding its clinical content and training at both the provider level as well as the mentorship level. This will also help adapt the model that we're developing to other states in India, as well as make it more relevant to other LMIC settings. One thing we're really interested in support is to integrate appropriate AI enabled functions into the app. So, for example, to strengthen decision support, to personalize learning, improve data analysis, and also identify potential patterns in antibiotic use. So, we would welcome collaboration with technology experts, technology mavericks, responsible companies that can help us to do this safely, ethically, and in ways that actually work in low resource settings. So ultimately, our ambition is not simply to scale the app, it's to build a sustainable support system that can bring these rural healthcare providers into a safer and better connected and more accountable primary healthcare system and network. So, viewers, please help us by connecting us with governments, funders, other researchers, technology partners working on community level antimicrobial stewardship. And we look forward to your support. Thank you.
Oh, great. Yes, and that focus on implementation and importantly, that local context, the adaptation is absolutely essential. Jasmine, what partnerships, funding, or other support do you need?
So basically, AMR sits at the intersection of communities, health systems, and data. So growth depends on strong partnerships across all these three sectors. We are looking to work with public health programs, community health organizations, and local authorities in India, as well as other LMIC settings to help us deploy and evaluate our framework across diverse contexts. We're also keen to strengthen our connections with the AMR surveillance and stewardship initiatives, including the national and state level AMR programs across our own country. As we expand, we would like to rigorously validate the AMR Aura and the AMR Orbit scorecards across different geographies and health system contexts to understand where they perform well and how can they be improved. So for anyone interested in getting involved, the support can be in the form of connecting us to deployment networks, supporting implementation and scale up efforts. More than any single resource, what we are looking forward is a combination of implementation access, strong data partnerships, and sustained financial support to generate the evidence required for scale.
Absolutely. And really thinking about the importance of validation is so essential. And that sort of primal, focus on data and the metrics that you need to demonstrate whether things are working or not. Go ahead, Craig.
Yeah, thanks. So throughout our work in the community, we are also identified several barriers to scaling our intervention, but we also identified a few partners that will be needed to overcome them. So our data has clearly demonstrated contamination of drinking water sources, for example, but this sustainable and scalable solutions require collaboration with the South African Department of Water and Sanitation, the Department of Agriculture, and the Department of Health. So our country already has a national action plan on AMR, and two key priorities of the strategies are establishing AMR surveillance systems within communities and also promoting responsible antibiotic use. So you see our work already closely aligns with these priorities. And so the engagement with national AMR action plan structures, particularly around emerging policies and implementation pathways, will be crucial for us to scale our approach. And then there's a need to engage our Department of Agriculture on two important issues. Firstly, addressing inappropriate practices by pharmaceutical distributors within the community. And secondly, exploring implementation pathways for our herd health WhatsApp platform. So once this has been tested within our NGO sector. So this platform already directly responds to the farmer's request for better access to livestock health advice and has the potential to support more appropriate antibiotic use at scale. So, of course, for any digital solution, you need to have effective infrastructure that supports them. And so, reliable cell phone, cellular connectivity remains a challenge in many rural areas. And so, we should be partnering with the network providers and the Department of Communications and Digital Technologies. And this will be essential for us to improve connectivity and ensuring that the farmers have access to the information and the support that they need. So if this work resonates with you in any way, we invite you to join the conversation, to become part of the solution. And this can be in the form of partnerships, policy engagement, technical expertise, and as many of you already mentioned, funding is quite important as well. And then, of course, community outreach, which we already do, but of course, there's also scope to expand this to other communities. And so there are many other opportunities to help us expand this work and to strengthen our fight against AMR in the rural communities in South Africa.
Oh, this is great. The connections, right? The networks of connections at local, to national to global and back, and the connectivity, making sure that those rural communities are connected from a technology perspective, I think are the key messages here and key takeaways. I'd like to thank you all of the great awardees for joining us today. I'd like to thank the Trinity Challenge. And viewers, please access the contact information we have provided if you would like to follow up. Thanks again.
Thank you.